Some basics about the skin is that beside being the largest organ of the body, it also prevents against infection and prevents water loss, bacterial invasion. It has three layers: epidermis, dermis, subcutaneous fat. Epidermis is above dermis, like the name suggests, and below dermis we have subcutaneous fat. In dermis we have connective tissue, vessels, and although it seems that epidermis is very thin, but it consists of 5 layers, namely stratum basal, spinosum, granulosum, lucidium, and corneum. In basal, we have stem cells which make new skin cells. In spinosum, these cells are spine-like and they are connected with desmosomes. When stratum granulosum starts, the cells start losing their nucleus, and eventually in corneum they appear thread-like. Now, if we see stratum basal, they are stem cells. Spinosum, we have spine-like cells, and desmosomes form spine-like cells. And in stratum granulosum, we have keratohyalin granules. Lucidum, clear layer of dead cells, and in corneum, anucleated cells which filled with keratin filaments. Now, if we see skin lesions, there are two types: primary skin lesion and secondary skin lesion. In secondary skin lesion, they usually result from trauma or external factor, like you might have a macule and you will scratch it, or you will compress a bulla and it will result in crusting, erosion, ulcer. अब जो flat वाले हैं, they could be macule or patch. Flat lesions. If macule, it's less than 1 centimeter. If patch, greater than 1 centimeter. An example of macule includes freckle. These are flat lesions. And example of patch includes birthmarks. They are greater than 1 centimeter. If the lesion is raised, then it could be papule or plaque. Papule is less than 1. It includes mole. And if it is greater than 1 centimeter, it is plaques like psoriasis में होते हैं. Less than 1 centimeter, raised lesion, papule. Greater than 1 centimeter, raised lesion, plaque. A maculopapular rash means it's flat as well as raised lesion present on the skin. These are characteristic of measles, rubella, syphilis, drug rash. They have both slightly raised, flat, but all in the range of 1 centimeter. Third, we have raised lesions with fluid on them. These are vesicles if less than 1 centimeter, like we get in chickenpox, and if greater than 1 centimeter is bullous pemphigoid. Again, lesions are laced and they have fluid in them. Secondary lesions are scales, like if you have psoriasis and you start peeling or flaking it. Psoriasis was basically plaque that was raised lesion greater than 1 centimeter. But if you start scratching it, it will peel and flake, and it will involve the 5th layer of skin, stratum corneum, will result in secondary lesions. Include fissure if it is narrow, and if it's deep, like burrow, like it's like someone has done digging involving both dermis, epidermis, it will be ulcer. And if only epidermis is eroded out, then it's erosion. Let's see again. Dermis, which includes blood vessels, connective tissue. Above it is epidermis, which consists of 5 layers. 5 layers, namely basal, spinosum, granulosum, lucidium, corneum. And subcutaneous layer includes fats, these are globules, and subcutaneous vessels.